As you all know, is that we had already announced around 12 counties that have are not paid our workers, our members, that's the clinical officers, medical officer, nurses, medical laboratory, among other healthcare workers. For them, like in Kisumu, they have not paid for the February now and March. Those are 2 months in arrears. And similarly, we have similar problem in Mombasa, who have been actually more of a chronic issue. We are now getting a communication from our branch official that Embu have paid and Nyeri have paid, and also Nyeri, like Laikipia have communicated to pay, that's by tomorrow. So we want to excuse them from the strike. And for the others, I think it is not acceptable that we'll allow members to go on strike, to go at work when they know that they cannot even afford fares, they cannot even afford their meals. So the issue is that we want to ask them to come out and to do a salary parade to ask for their salary.
The reason why we did not say it's a strike, because when you give a strike notice, you need to sit down with the employer and bargain about the issues that you've raised. But the issue of salaries are things that cannot bargain, or cannot be negotiated. They need to be paid to facilitate workers to be at work. Any county that is giving a promissory note, we will not take it. We want monies in the accounts. So even as per the promise that we got from these other 3 counties, they indicated that by the end of today, tomorrow they'll have paid. But we keep on saying, any county, regardless of the status of that county, if they're not paid by Wednesday, they don't expect to see workers in those particular facilities because they have no ability to be at work. We have also proceeded to court against these particular counties because it's an injustice and it's a contravention of the Constitution of Kenya. Every worker has to be paid their dues and have a right to their fair remunerations once they've offered the services. You cannot say you prioritize health sector when we know the unit of preparation of healthcare is in the counties. As much as it is currently, you will go to the dispensary that is managed by the county governments. The level 1, level 2, the level 5 county facilities are managed by the counties. And it means that if the funds disbursement to the counties have delayed for the period of 4 or 5 months, there's nothing that is going on in those facilities. That means the issues of salary is just a time bomb that is showing up other things. It means there are no drugs, that the KEMSA and all others have been paid. They cannot pay suppliers. It means that there are no reagents, you cannot diagnose, you can't use the diagnostics to actually check the patient. It means that the patients will have to buy even gloves to be seen in those facilities, unless governors have other ways of getting the funds. So that's the reality that happens.
We really need to call on the national government, the county government, to find a lasting solution. Because when the county tells us that they have not paid because of not receiving the allocation from the national government, for us, our question is, where does the other counties get money to pay, and where does the national government get money to pay? So this confusion, it's not us to get the clarification. For us, what we want is that no negotiation about pay members, and let's move on.